our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Secretary, from CNHI, can you provide an update regarding whether the Department of Health will begin providing county officials with more information about where coronavirus cases are in their counties?
Yes, so we will it means that we have widespread community transmission of COVID-19 in Pennsylvania. We are seeing increases particularly in southeastern Pennsylvania, Philadelphia, the suburban collar counties of Philadelphia, and in the Northeast, particularly in Lehigh County and Luzerne County and Monroe County. So COVID-19 is still being widespread in that area, and people are being infected through community spread, and that highlights the significance of stay-at-home orders. The best way that you can protect yourself, your family, and your community is please stay home.
Secretary, from the Times News, if a life-sustaining business like a grocery store has an employee, are they under any obligation?
It would be very hard to tell customers because they don't keep track, of course, of who comes in and comes out. But there are specific rules in terms of people who have had close contact, other employees, etc., who have had close contact. And then there are cleaning recommendations for businesses.
Secretary, from ABC 27, today the Hospital Association of Pennsylvania said hospitals are losing as much as $2 billion a month during the pandemic. They're asking for tax forgiveness and a fund to help offset the losses. Are you aware of the problem, and what guidance could you offer?
So we are aware that COVID-19 has put a significant strain on almost all businesses in the Commonwealth, including hospitals and health systems. And we very much appreciate all of the collaboration that we have received from hospitals, health systems, and the Hospital Association. We are aware of those losses, and so we'll be looking for resources to help. And of course, there will be federal resources coming to help as well.
Secretary, from WNEP, a question about the home health care field. They have a viewer who reports that they work in the home health care field and they're starting to see an influx of requests from hospitals to take over the care of COVID-19 patients being discharged to home. What are the plans in place to ensure that home health has the same access to PPE that hospitals and nursing homes do? So
it is very important for patients with COVID-19 who have been in the hospital and then are well enough to go home. If they stay in the hospital, then it makes it impossible to admit more patients because the hospital will be full. And so for any home health care worker, direct care worker that is working with a patient with COVID-19, we need to make sure that they have the adequate personal protective equipment and they know how to use it. So we will be working with the healthcare associations to make sure that that happens.
From WGAL, the cases continue to rise in the state. Is social distancing working? And if it is it working? And if it isn't, what can be done?
So social distancing and the mitigation efforts that the governor has put in place are working. They're working in many places in the country, as has been outlined a number of times by Dr. Fauci and Dr. Birx in their press conferences for the federal government, and they are working in Pennsylvania. We are still seeing increases. We are not out of the woods by any means, but the curve has changed. It has gone from that exponential rise that we had talked about, where it was doubling every number of days, to a somewhat flatter curve, but it's not completely flat. We are still seeing increases in the number of cases of COVID-19, particularly in the Southeast and the Northeast. So we need to maintain our vigilance. We need to maintain our efforts at social distancing and make sure that we buttress the healthcare system for the potential surge of cases over the next number of weeks.
Secretary, from the Citizens Voice and WJAC, some questions about when we'll be able to return to normal. Once the curve begins to flatten, what signs will you be looking for? And do you envision a gradual reopening, or would there be a more specific date when everything would reopen?
Well, as I said, we don't know what specific date this will be. Dr. Fauci has said that the virus determines the timeline. It's very important for us not to, in a predetermined way, determine the timeline, but to follow the course of the virus and the number of new cases that we're seeing. But it is very important to have hope. There will be a time where we will be able to start to relax the social distancing that have been put in place, to relax some of the business closures and the stay-at-home orders. But it will not be one grand day where we do that in Pennsylvania. That would be extremely dangerous, and it's certainly not going to be one day. It's going to be over time. It'll have to go in a very slow, progressive fashion, perhaps community by community, county by county, watching the situation very carefully for any increases that would require us to reinstitute something. We are making plans about, but we need to follow the timeline as the virus determines it.
Secretary, mass testing sites and temporary medical centers in the Northeast. Are there plans for that right now, and can you give us more information?
Yes. So there are plans for a mass testing site in the Northeast, and there are plans for a field hospital in East Stroudsburg in the Northeast. And so the Department of Health, really led by Director Padfield and Pima, are working on implementing those at this time.
Secretary, from WTAE, yesterday you described some of the efforts underway to better protect patients in nursing homes. Can you recap those for WTAE?
Sure. So patients in nursing homes, in long-term care living facilities, and including personal care homes, are some of our most vulnerable citizens in Pennsylvania. First of all, seniors are more vulnerable to COVID-19 and to having a severe case of COVID-19. And those with chronic medical conditions, such as chronic heart disease, chronic lung disease, like chronic obstructive pulmonary disease, chronic kidney disease, diabetes, are also more at risk. And so we take that responsibility very seriously. And so we are working with all long-term care living facilities to make sure that they implement all of our guidelines and the guidelines from the federal government. And then we're in contact with them if and when they have a case of COVID-19 about infection control procedures. And we are working with them every day. In addition, we have hired ECRI, a company, to do more infection control and to actually further our reach. Now, that's all virtual in terms of over the phone or over other media, but they can even do virtual tours to make sure that nursing homes have the right infection control procedures in place.
Secretary, from the Press and Journal, several reports are questioning the role of ventilators for COVID-19 patients. One story states that New York City officials have said at least 80% of coronavirus patients who were put on ventilators there ultimately died. What is the Pennsylvania Department of Health's stance for their use, and has it changed?
So I have read those articles. You know, as we've been saying, this is a novel coronavirus. This is a new virus that no one has ever seen before, and healthcare providers have never seen before. So, of course, we will need to learn the best way to take care of those patients. Of course, it's only the sickest patients that get put on a ventilator in the first place. And so I have no specific guidelines or recommendations for intensive care physicians, but they'll need to take all of that information and apply it to the care of each individual patient and to individualize that care for their best outcome.
Thank you, Secretary. That is the last question for our briefing today. Our next briefing will be tomorrow. Thank you.